Your heart is an extraordinary machine. During your lifetime, your heart's muscular walls pump blood into blood vessels branching throughout your body.
The human heart has 4 chambers. The 2 upper chambers are the atria, and the 2 lower chambers are the ventricles. The interatrial septum separates the 2 atria, and the interventricular septum is the partition between the 2 ventricles. The right atrium and right ventricle are connected through a tricuspid valve. As the name suggests, it has 3 leaflets or cusps. On the other side, the left atrium and ventricle are connected through a bicuspid valve. The bicuspid valve is also called the mitral valve because of its resemblance to a bishop's 2-sided mitre or hat. The leaflets of these atrioventricular valves are connected to fibrous tissue called the chordae tendineae, which in turn are attached to papillary muscles. Contraction and relaxation of these muscles make the valves open and close. There are also valves at the opening of the pulmonary trunk and the aorta. These are called the pulmonary valve and the aortic valve, respectively. Because of their crescent moon shape, these 2 valves are also called semilunar valves. The characteristic double-up sound of the heartbeat is produced during the closing of the heart valves. The thickness of the walls of the 4 heart chambers varies with their functions. The walls of the atria are thinner than those of the ventricles, as the blood needs to be pumped into adjacent ventricles only. The left ventricle pumps blood a greater distance at higher pressure. Therefore, the wall of the left ventricle is thicker than that of the right ventricle.
In order to pump blood more efficiently, your heart muscle, called myocardium, is arranged in a unique pattern. 3 layers of myocardium wrap around the lower part of your heart. They twist and tighten in different directions to push blood through your heart. When special cells, called pacemaker cells, generate electrical signals inside your heart, the heart muscle cells, called myocytes, contract as a group.
The sinoatrial node, atrioventricular node, bundle of HIS and Purkinje fibers represent the specialized cardiac tissue. These fibers are autoexcitable as they have the potential to generate electrical activity without any external stimuli. This makes the heart beat continuously.
ACS and MI. Acute coronary syndrome, or ACS, is a set of 1 or more conditions that cause the blockage of blood flow to the heart muscles, resulting in a myocardial infarction, or MI. Arteries, known as coronary arteries, are connected to the aorta and supply the muscles of the heart with the necessary oxygen and nutrients. In acute coronary syndrome, there is a blockage in the blood flow through the coronary arteries, usually due to an atherosclerotic plaque, a coronary artery spasm, or a coronary artery dissection. In atherosclerosis, the continued deposition of a fatty plaque results in the narrowing of the involved coronary artery. Rupture of this plaque results in the formation of a blood clot, thereby causing a blockage of the involved coronary artery. The formation of a blood clot is the most common cause of a coronary artery blockage. Such a blockage to either of the coronary arteries results in oxygen and nutrients failing to reach the part of the heart supplied by it, causing the death of the heart muscle, a condition known as myocardial infarction. Symptoms of a blocked coronary artery include sudden pain or discomfort, tightening, or a burning sensation in the chest, known as angina, which may extend to the upper abdomen, shoulders, arms, neck, or lower jaw. Other symptoms of acute coronary syndrome include 1. Breathlessness, 2. Dizziness, 3. Sweating, 4. Nausea. Treatment of acute coronary syndrome, or an MI, usually involves the following. 1. Oxygen therapy, to increase the amount of oxygen delivered to the blood and heart. 2. Aspirin or antiplatelet therapy, to prevent blood clots. 3. Thrombolytic therapy, such as TPA or streptokinase, to break up existing blood clots. 4. Nitroglycerine and morphine, to relax the coronary arteries and relieve the pain. 5. Beta blockers, which reduce the heart rate, thereby decreasing the oxygen requirement. 6. Coronary angioplasty, an interventional procedure in which a balloon-tipped catheter is inflated inside a blocked coronary artery to open it, with a stent remaining behind to keep the coronary artery patent. 7. Coronary artery bypass grafting, or CABG, pronounced as CABG, a surgical procedure in which the blocked coronary artery is bypassed with a vein or artificial graft material in order to re-establish blood flow to the heart.